Hi, my name is Olga. I'm from Nightingale College. Today I'm going to be performing the intermuscular injection. I will go over some supplies that I'm needed. I will have my two alcohol wipes, my gauze, my clean gloves, and my medication vial, which is the morphine sulfate. Also, for this injection, you will need to use a 22 to 25 gauge to 1.5 needle, a 1 milliliter syringe. In this case, we're going to use the 22 gauge needle, and we are going to use the 3 milliliter syringe, 3 milliliter syringe. Okay, perfect. Now we got that out of the way. Next, we are going to go over the 6 rights of medication. That is right patient, right drug, right dose, right route, right time, and right documentation. Once we get that out of the way, we're going to check the medication orders. It is 6 milliliters per 1 milligrams. We are going to check that in the EHR. We're going to do that 3 times before giving any medication to our patient. All right, next, we're going to calculate the dose. So I have written down the calculations. I'll bring it up. There's nothing in the back. So the calculation is 1 milligram over 4 milligrams. It's going to be ml over 4 milligrams times 6 milligrams over 1, and that is going to equal to 1.5 ml. Next, we will gather all our supplies. We'll gather all the supplies. We're going to knock. We're going to enter the patient's room, and we're going to close for privacy. And we're going to make sure that there is no HIPAA violations of having the patient's family in the room. Next, I'm going to set my supplies on a clean, dry surface, and I will hand hygiene and introduce myself to the patient. Hi, Ms. Smith. My name is Olga. Today, I'm going to be your nurse today. Can you please verify your first name, your date of birth, and your first last name? Okay, perfect. And we'll check her wristband. That is my 2 patient identifications. All right, next, I will ask the patient do you have any allergies, Ms. Smith? Any food, medication, or seasonal allergies? No known allergies? Okay. Second time, I'm going to be checking in the MR. Perfect. Next, I'm going to talk about the medication to my patient. So, Ms. Smith, today your doctor has prescribed you morphine sulfate. This is to help with your pain. The use is to treat moderate or severe pain. Some of the side effects that you might be experiencing is constipation, drowsiness, or nausea. And then some of the adverse reactions. If you do have some, please let us know. We want to help you as soon as possible. It would be tachycardia, it would be hard breathing, shortness of breath, or if you feel like fainting, please let me know and we will let your provider know. Next, I'm going to ask my patient, do you have any questions, Ms. Smith? No? Okay, I just want to let you know that before I start the medication, the injection, you will feel a little burniness and you're going to feel a little poke, and that is normal, okay? All right, so now that I have told her everything about the medication, I'm going to hand hygiene, and I will put on my clean gloves. And I will get my medication ready. So our patient is going to receive morphine sulfate 1.5 milligrams. So I'm going to start, and we're going to confirm in the system, in the EHR, and I'm going to start by wiping with my alcohol wipe. Make sure that this is nice and clean. I will dispose. I will let that air dry. I will not touch it. Next, I'm going to put my needle into the syringe. I will open it. Make sure I don't touch it. Be as sanitary as possible. Perfect. I'm just gonna put it on. We're gonna do that. All right, next, I'm gonna toss that. Next, I'm going to put in my air, 1.5 mLs. I will hold it as a pencil up. So 1.5 mLs. You guys can see that. Okay, perfect. Next, I'm gonna take my 2 fingers here. I'm gonna take off the cap. We'll use this next for 1 scoop method. I will place the needle in my valve. I will put in the air back in, and I will pick up my valve upside down, and I will draw up my medication. I will tap to make sure that there's no bubbles. In this case, there's no bubbles. I will take it out, and I will show you guys that it's 1.5. I will do a 1 scoop method before I show you guys. There we go. And so now I will show you that it is 1.5 mLs. You guys can see that. Okay. There we go. Next, I will identify the site. In this case, for the intermuscular injection, the patient can get it in the deltoid, in the arm, in the lateral, in the thigh, and also in the ventral glutei. So the patient decided that they want to get their medication in the gluteal area. So I will identify the site. I will take my hand, I will place it with my ulnar hands. I will create a V with my fingers out, and this is the area that I will be putting my shot in. I will also inspect to make sure that there's no edema or any discoloration, any redness, any swelling. I would also palpate to make sure that there's no tenderness or swelling. Perfect, there's no tenderness. After I inspect and I find the site, I will go ahead and I will clean the area of the site with my alcohol wipe. And we will start by 5 inches and 2 inches, 5 centimeters, 2 inches out. Center it out. I'm gonna let that air dry. I'm not going to touch it. Discard that. Next, once my area is dry, I'm gonna grab my syringe and I will take up the cap. And we are going to go at a 90 angle, and we're going to go as in a dart, and we are going to make sure that our palms are down. I'm going to grab here for support. I will pull back the skin. I will go into 90 degree. I will pull back to make sure that there's no blood coming out, no blood resistant. Okay, perfect. And I will push in my medication. Once I do that, I'm gonna leave it in for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I will pull back. I will discard my needle, and I will put the gauze on top, and I will apply a Band-Aid if needed. Next, I won't recap the needle. I will just toss that. I will take off my gloves. I will hand hygiene, and I will document my procedure.